Hello, my name is Andrew Papworth and I'm a research fellow here in the Martin House Research Centre. And I'm going to be talking about a study that I've been involved with for the last 2 years, which was funded by the Martin House Research Centre itself. The study is called SWiCH and it's focusing on staff wellbeing in children's hospices and aims to increase understanding about the work-related stresses and rewards experienced by children's hospice staff, and to identify staff support systems and organisational practices that offer the most potential to enhance staff wellbeing at work. The study was conducted in 2 phases. The first phase was a review of the literature to find out what information is already out there, and also the development of a survey. The survey itself included some standard measures used in research like this, such as burnout and core engagement, and also a new scale that we adapted from one that has previously been used in pediatric oncology. So this is the original pediatric oncology scale, and how it works is there are different scenarios listed, which you can see here in the middle. Some that people find stressful and some that people find rewarding aspects of their jobs. And they score on the right-hand side how stressful or how rewarding they find these individual scenarios or items. And there are 4 examples here for each, but actually these scales are quite long in both instances. But we wanted to make some changes. So because pediatric oncology and hospices are quite different settings. So firstly, we asked staff members in 5 UK hospices to review those original pediatric oncology scales and tell us which items in there were relevant to them or not relevant to them. We then conducted focus groups with 16 staff members at 3 hospices, and they told us why they thought some of those items were more or less relevant to their work. We then drafted new items and reworded some, and finally did some interviews with 14 staff members to review those final scales. And we found some similarities, some differences between the hospice setting and pediatric oncology. And I've just highlighted these 3 items that are in the new hospice scales, because one of our main findings at this stage of the study was that for hospice staff, sometimes the death of a child or events surrounding the death of a child can be a positive part of their job, whereas for pediatric oncology that was not the case. So you have these 2 items at the bottom: getting it right for a child when they die, and helping a family to make memories. We then use these scales in the national survey, which is phase 2. So phase 2 included a national survey of hospices first. So we looked at 32 hospices across the UK and the Isle of Man, and we asked them about their size, staff-patient ratio, shift patterns, the number of children who died in the past year, and also collected data on their staff support mechanisms. So we understood what was going on in the individual hospices, which is quite a heterogeneous group of settings. And then we also surveyed staff in those 32 hospices, and we received 583 responses to the survey. 281 of those were from those in medical or nursing professions, and 245 in other professions, including allied health professionals, nursing or healthcare assistants, nursery nurses, social work professionals. These are the results from the stresses and rewards scale. So if you focus just on the right-hand side, this is how rewarding staff found these individual items. And you can see I've underlined in red those items that staff considered to be the most rewarding. And then the same for the stressors scale. Again, I've just looking at the right-hand side, and I've underlined in red those items that staff found the most stressful part of their job. And then the stressor scale is quite long, so there's the second slide on that as well. And in terms of our outcome measures, we looked at burnout, which is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. So we use the Copenhagen Burnout Inventory. This is one of the standard measures that I mentioned earlier on. And staff who responded to the survey had an average of score of 34.6. 12% of participants were experiencing moderate to severe burnout. And this score of 34.6 is quite consistent with other caring professions. In fact, it might be a little bit lower than in other settings, in other professions. And also there was no significant differences in burnout between clinical and non-clinical staff. So that's medical and nursing versus those other professions. And another outcome measure that we looked at was core engagement, which is a measure used in the NHS staff survey. And the average score for those that responded to that in our survey was 7.47, which compares to the NHS staff average of 7 in 2020. But that's also been consistent over the last few years, that it's been about 7 for NHS staff. A third of those respondents to our survey said that they'd felt unwell as a result of work-related stress in the last 12 months. So the next steps, we're now at the analysis stage. We also need to validate the new stresses and rewards scales. And we'll be combining data from the staff survey and the hospice survey to look at what organisational factors can influence staff psychological wellbeing. Thank you very much.